Good afternoon. Thank you all for joining us for today's QC COVID-19 press briefing. It is 3:30 on Thursday, February 18th. Today we are joined by Ed Rivers with the Scott County Health Department, Janet Hill with the Rock Island County Health Department, and we also have with us today Tony Knobe with the Scott County Board of Supervisors and the Live Lead Free QC. First, we're going to go with numbers for both counties. Janet, we'll start with you.
Hi, everyone. We are reporting 24 new cases today of COVID-19, bringing our total to 12,696. We have 11 in Rock Island County hospitals, and our deaths remain at 302.
In Scott County, we've had 16,835 cases, and our deaths are at 199.
Thank you. We'll first hear some prepared statements from Public Health. We'll start with Janet Hill with Rock Island County Health Department.
Winter keeps giving us the 1-2 punch. First, because of persistently cold weather, the next 3 Rock Island County Health Department mass vaccination clinics will be held at the Tax Slayer Center in Moline. Those dates are February 23rd, March 2nd, and March 9th. We will reevaluate weather forecast and site availability closer to the March 16th clinic, and we will make a location announcement then. We remain grateful to both the Tax Slayer Center and the Greater Quad City Auto Auction for graciously sharing their facilities for this historic vaccination effort. The other punch comes from vaccine shipments being delayed because of record cold temperatures and snowstorms hitting the southern swath and a great deal of the eastern parts of the United States. Vaccines are routed to our area through UPS shipping hubs in Louisville, Dallas, Philadelphia, and the Chicago area. All of these places were dealing with winter's wrath this week. Without vaccine shipments arriving this week, we are unable to hold as large a clinic as we had been the last few weeks. For Tuesday, we have cobbled together about 200 doses, some of which are going to people who signed up through our partnership with Alternatives for the Older Adult. If we get another shipment before Monday, we will add slots to the February 23rd clinic on Tuesday. In the meantime, please know that we understand your frustration. We are frustrated too. We, along with our healthcare partner and pharmacy partners, want to vaccinate everyone who wants it. This is how we get to the other side of the pandemic. But right now, vaccine supply remains scarce, with or without a winter storm. Please continue to be patient, wear your mask, watch your distance, and wash your hands. Thank you.
COVID-19 vaccine remains the topic of the year. This means you can hardly turn on the TV or jump on social media without seeing news stories about vaccine brands or vaccine supply. A number of national stories have run recently reporting a large increase in vaccine in the US and in Iowa in the upcoming weeks. We're excited to hear that supply will be increasing, and we're eager to ensure vaccine is available in Scott County to all who want it. However, increased vaccine supply won't make a difference until it actually reaches our county. Right now, we ask that you continue to remain patient and your turn will come. Because the virus is still circulating and additional strains are being found across the US, it remains critically important that we mask and social distance until enough immunity is built up between groups of people that it's safe to relax those measures. We don't want to slip backwards with all the progress we've made. But the COVID-19 pandemic isn't the only public health challenge that we continue to face as a community. Due to the variety of factors related to the pandemic, we in public health are finding a dramatic decrease in the number of children being tested for lead. Lead testing remains a vital component of childhood health. Partners from Live Lead Free QC are here today to discuss this issue more.
Hi, everyone. So in addition to my role at the Rock Island County Health Department, I am a member of the Live Lead Free Coalition, as is Ed and many other people in the Quad Cities. Tony is the president of the board. So we're here to talk to you about the importance of lead screening and the importance of getting rid of lead hazards in our homes. So can everyone see the PowerPoint at this point?
Yes, you're
Yeah,
good, Janet.
I can see
Okay,
it. Yep.
thank you so much. Okay, so both Iowa and Illinois are known to be in something called Lead Alley in the Midwest. You can see from this map here that the darkest blue states have the worst lead contaminations for children in the country. So it is a place where the housing stock is older and that there are a lot of children living below the poverty level, or at least in low income housing throughout the region. So Illinois and Iowa are both affected by this. So about 25% of the housing stock in both Illinois and Iowa is very old, which puts us on the Housing with Lead Risk Foundation from the United Healthcare Foundation. So in Rock Island County, we have a lead program, as does Scott County. This year, we are seeing a 36.5% decrease in the number of children being tested for lead. This is extremely upsetting to us because we know that lead is a lifelong problem if it's not caught early, and it particularly affects children who are younger than 6. And it's because they are down on the ground. They are putting their fingers in their mouths where there could be some lead dust. So even though there's still a decrease in testing, we still have 80 children with elevated blood levels in Rock Island County. So when a child is found to have an elevated blood lead level, that's when our case management program starts. In Illinois, a child is found to have an elevated blood lead level when they register at 5 micrograms per deciliter of blood. That is a tiny amount of lead, but it's just important to note that any amount of lead in a child's body is not safe. So 5 is still very much a concern. A case manager, once a child comes under our caseload, we will go to the house during normal times. Right now, we are doing that by phone, which, as you can imagine, is a little bit harder. But our case managers have been doing this for a long time, and they are well versed in knowing where lead hazards usually reside. Oftentimes, it's windowsills or baseboards that have been painted and are chipping. So they're able to do their job as best they can without doing home visits. We have on a couple of cases allowed the case managers to do home visits in cases where the families were, there was a language barrier, or the child just had such a high level that we needed to jump on it right now. We also then will remain in contact with the family to ensure that follow-up testing is done. And then if once the home inspection is done, we will refer to the state environmental lead risk assessor. And then if the home needs to be abated, we will refer to a lead-based hazard reduction grant that we have here on the Illinois Quad Cities that we will tell you about shortly. The Scott County lead program is very similar. The only difference is that in Illinois, the intervention level is at 10 micrograms per deciliter, which is still way too much. But the Scott County Health Department gets very concerned at 5 micrograms per deciliter because, as we said, no amount of lead is safe in a child's body. So their case managers also will offer nutritional counseling and developmental screenings and follow the policies laid out by the Iowa Department of Public Health. They will educate family about the environmental services that are indicated through IDPH guidelines. And then they will offer an opportunity for lead renovations fund through the lead-free Quad Cities, which we're here to talk to you about. And Tony, you want to take over from here?
You bet. Thank you, Janet. And thank you all for your time and attention here today. As mentioned earlier, I do serve on the Scott County Board of Supervisors. But earlier on my tenure on the board, we started discussing, or we continued the discussion of funding of this organization, Live Lead Free Quad Cities. And I asked Ed Rivers to join one of their board meetings just to see what it was all about. And pretty quickly thereafter was asked to join the board and now serve as its president. So I think we all understand that lead is dangerous. Here's a little bit of history on it. Really, it was believed to be dangerous back as early as the 1800s, but it wasn't really until the 50s and 60s that any movement began to try to legislate changes regarding the use of lead. So we first started by removing lead from gasoline as a lubricant, from lead paint because it made the paint smooth and flowed easier, and eventually banned it from lead plumbing, from food cans and so forth. And you can see that it had an immediate and a drastic effect on lowering blood levels. The red line is the base lead level in the population, where the presence is greater than 10 micrograms per deciliter. And the blue line is the grand mean of all blood levels. So next slide, please. So we asked, and really I give credit here to Ed Rivers and the staff of the in the Scott County Health Department, asked Augustana College to help us. And they conducted a study of where the risk is likely to be the greatest in the Quad Cities and in Scott County in particular. And they pretty quickly determined, based on national data, that there are some indicators or some factors that point to a likelihood of high risk of lead poisoning or of lead presence in homes. And it's pretty easy to guess the first one, and that's older homes built before 1978 when lead in paint was outlawed. But also there are some other factors that, while not absolute indicators, do point to the likelihood of increased lead hazard, and that's social economic status, lower income families, ownership status. If it's renter occupied, they're highest in risk. African American neighborhoods tend to be higher in risk. Urban neighborhoods are generally more risky than rural neighborhoods. And nutritional status, which I think certainly goes hand in hand with social economic status in many cases. Those all point to higher risks. And from that data, next slide, please. Augustana produced for us what we call a heat map, showing where those risks are greatest. Now here's Scott County as a whole. Red is the highest risk and blue is the lowest risk. So you can see, great concentration of red in the central Davenport, but also some other pockets throughout the county: Princeton, Maysville, North Davenport, Northwest Davenport, in that Bettendorf, LeClaire border corridor. Next slide, please, if you would. And here's a close-up of the central Davenport area. Now, I want to point out that because your house happens to be in a predominantly blue neighborhood does not mean that your home is necessarily safe. You might live in an older farmhouse in a fairly new neighborhood. And conversely, if you live in a predominantly red colored neighborhood, doesn't necessarily mean that your house is unsafe. Perhaps your home has been renovated, maybe torn down to the studs and all of the wall coverings and floor coverings replaced, making it quite safe from lead. This is simply a map that we use to determine where to focus our efforts on education, on distributing flyers and other materials that might encourage people to ask the question, is my home safe? And to get us involved if they want some help. Next slide, please. So a little bit about lead and its hazards for a couple of slides. I want to point out that it's cumulative. This toxicant is cumulative. It comes into our bodies in various ways, but it stays there in particular throughout our lives. And it distributes itself and settles in the brain, liver, kidneys, bones. Interestingly, about the only instance where I've heard of it being released from our bodies is during pregnancy. A mother can release lead from her bones into her blood and travels eventually to the baby, who can be exposed to lead poisoning before they're even born. Next slide, please. So as you can see, and I'm not going to spend a lot of time here, but even at a very low level, at 5 micrograms per deciliter, you can see that it already begins to affect attention-related and social behaviors in children, especially in children. And we say children because, number one, their brains are still developing, and so the damage from lead is greatest in children. Number two, they're unable to be aware of those hazards, that they should stay away from ingesting lead paint, and how do you stop from breathing it if it's in the air. And number three, it affects them permanently throughout all of their lives. Now you can see that at high enough levels, it can lead to even death, but it affects many different systems within the body. So we really do focus on those 0 to 6 year old child households. If you can imagine, one of the problems with lead is that lead tastes very sweet. And so we know that all of us, but especially children, love to eat sweet things, and they will chew on windowsills that happen to be at the level of their mouths. They will breathe in the dust from doors and windows that perhaps don't fit well, and chafe and release lead into the air. They will pick up lead chips from the floor and chew on them. Next slide, please. So we know there's a problem. We know that COVID has exacerbated that problem by the fear of going to public places to have your children tested. So now what do we do? And that's where Live Lead Free, and as Janet will describe a little bit later, some of the HUD programs that are actively being implemented in the Illinois Quad Cities come to play. So our organizations already conducted the research, and that's what you just saw, those heat maps and the studies as to where the problem exists. We have sought and received some funds, and will continue to receive funds, we hope, for mitigation of lead. We're getting the word out in the community. This is one of the ways we're doing that, and we're asking for your help in that. Most of the homes that we've worked on so far really come to our attention through the process of pediatricians and other health professionals who are testing these children and finding that the blood levels are elevated, report that to the state, who then reports it, if it's high enough, back to the state, to the county health departments. And in the case of the Quad Cities, Scott and Rock Island counties will get us involved if need be. They'll, as Janet said, intervene immediately with that family if the level's high enough. But in any case, give us a heads up and ask that family to ask us for help, quite frankly. So we provide some funds for that, and hopefully remediate those homes. Here's just a slide that shows the logos of the organizations that are represented on our board, and you can see it's a great public-private partnership. We've got city, county, health department, hospital, housing professionals, all kinds of folks who can bring something to the table to help, and have a lot of knowledge to help us out with this. I want to be clear that we are talking about remediation and not abatement of lead. Because that lead tastes sweet, the very simple answer to the problem is not to remove all the lead, but quite frankly, to scrape and sand those painted areas, make sure that there's no loose paint, and then they get painted over with a very bitter tasting paint. And so therefore, reducing the likelihood that child is going to want to chew on those surfaces or eat anything that peels off of those surfaces. So it's a simple and a relatively low cost solution as compared to gutting a home and starting from scratch. So it seems to work very well. So our funding so far has come from Scott County very generously, with a couple of $100,000 and a $50,000 grant from the Scott County Regional Authority. We've gotten some smaller donations and expecting a couple more, but we'll be asking for more money from nonprofits, churches, civic clubs continue to ask money from the local foundations who might have a kind heart towards our cause, and individual donations. So I think it's important to note that for, it's even for a retired banker, it's a pretty easy sell, because you look at the return on investment. If you think about the damage to society that gets created when a child is poisoned by lead, they're non-productive potentially for their entire lives. They may get involved with the law enforcement system and the incarceration system. They're a burden on schools, they're a burden on families, they're a burden on society. And so it's pretty easy to do the math that our money is being well spent. It does, for the homes we've done so far, the average cost is somewhere in that probably about $12,000 to $15,000 range. Some have been as cheap as a few $100s, and in some cases, we've replaced windows in houses and maybe creep over that $20,000 figure. If a family has some means, we will ask them participate in the cost of that. If they are not able to, generally speaking, we would fund 100% of the project. And next slide, I believe, is yours. Back to you, Janet.
So while Rock Island County, the Rock Island County Health Department and Rock Island County cities are involved in Live Lead Free QC, right now we have our own federal HUD grant for people who live in Rock Island, Moline, East Moline, and Silvis. And that is a way that families who are income eligible can get their homes made lead safe through this grant that is being administered by the city of Moline, but anyone who lives in those cities is eligible to apply. So how you do that is you visit the website that's shown here, or you call KJ Whitley, the program manager, and that number is 309-524-2044. So there are a couple of stipulations: that the home or apartment must be built before 1978, and that there must be a child younger than 6 living in the home, or at least spend 60 hours a year in the home. So we've had a couple of grandparent homes where the child spends time, visiting grandma and grandpa. They've been able to get their home made lead safe through this program. This is a multi-year grant, and we are in year 2, I believe. So we've got a little bit more time. We're hoping that because of the pandemic, there could be a little bit of leeway, but sometimes we don't have control over that. So how can you get involved? We ask you to educate your clients and the public about the dangers of lead. The most important point is no amount of lead is safe in a child's body. 5 micrograms per deciliter is too much, and that is a tiny amount. And as Tony has said, this causes lifelong learning and behavioral problems. And if we can get it taken care of when a child is very young, and also make that home safe for future children who might live there. If we can get the lead taken out of it, or at least mitigated, that will help future generations also. So we ask that you consider giving financial donations to Live Lead Free QC, or at the very least, understand just how important this problem is in the greater Quad Cities. So any other questions, we'll be happy to answer them. Thank you.
I see one in the chat box asking why the amount of testing is down so sharply. And I think we touched on that, but I'll maybe expand, or ask Janet and Ed to expand as well. But basically, our belief is that there are fewer families that are bringing their children in for regular child visits. And that's very important. We need to get the word out that they need to continue those, because it's a fear of COVID thing. We get that, but there are other hazards that remain present to those children that need to be addressed. So I hope that answers the question.
So in Rock Island County, one of the main sources of children getting tested for lead is the WIC program. The state of Illinois has very strict rules that anybody who is on Medicaid must be tested for lead at age 1 and age 2, so 12 and 24 months. Many of those clients are on our WIC caseload. For almost a year now, we have not seen children in our WIC clinic. We've been able to serve them remotely and then through curbside pickup for benefits. So we ask a lot of lead safe questions, but we haven't been actually able to see children in our clinic. We hope to be able to see children later on this year because this is a really important safety net to make sure that kids get their lead testing. State law requires that any child must be tested for lead before entering kindergarten. But if we can find out that they are lead poisoned at age 1, that will only make their situation better, that they can have a full recovery.
Okay, Janet, I do have another question that popped up here directly to me for Rock Island County regarding the vaccine shipment delay. Will the vaccines end up stockpiling in a way? And meaning, is there a chance that you could get a shipment of 1,000 plus in a couple of weeks? Or is the vaccine being allotted or distributed to other areas that can get them right now?
You know, I actually don't know that answer. We normally have a shipping confirmation, or at least a notice that shipping is coming by Tuesday. We have yet to receive anything. We often receive vaccine for next week's clinic on Thursday afternoon or perhaps Friday morning, but we've received no word. The state is trying very hard to distribute this as equitably as possible, taking a look at the disease burden and the special populations that need to be vaccinated as quickly as possible. Rock Island County has been fairly consistent in our allocation, but going forward, I just don't know that. We perhaps will know that early next week, but today I don't.
Okay. I don't see additional questions right now. I know you put your contact information on there for lead-free QC. So we encourage any media partners to reach out should they have some additional questions. We appreciate your willingness to share this important information about the concerns with lead poisoning testing and just making sure that that is still taking place. We will be putting these recordings on our websites as well as on our social media pages. So we encourage you to check there for additional information as well as the recording should you have missed something in here. Thank you all for joining us today. We look forward to talking with you again next week. Have a good afternoon.
Thank you all very much.